Make the choice to begin anywhere in your life, and the journey has started. And along the way, be inspired. Listen to the stories by joining the president of Howard University, Dr. Wayne A.I. Frederick, on The Journey.
So we have all seen many stories from across the country about first responders in the healthcare field. But have you heard about the courageous work from Howard University hospital employees? These frontline workers will share their stories of how they're able to strive and serve the community in the COVID-19 crisis. My name is Dr. Wayne Frederick, and my guests today on the journey are Dr. Maureen Bell, Medical Director of the Emergency Department here at Howard University Hospital, and Fernandez Blackshear, a charge nurse in the Emergency Department at Howard University Hospital. Welcome to both of you.
Thank you for having me.
Thank you, Dr. Frederick.
So let me start with you, Dr. Bell. What attracted you to emergency medicine in the first place, and probably overall to medicine in general?
I grew up in rural Jamaica, where my mom was a nurse in the local community hospital. So from the time I was about 5 or 6, I had lots of experiences running down the corridors outside the wards. And as a child, I knew I wanted to be a doctor. When I got to medical school, I had just entered my 4th year, not really knowing what specialty I would choose. But after 1 week on my emergency medicine rotation, I knew that was where I belonged. Because as a physician, that was where I felt I had the opportunity to make the greatest impact where the patient was most vulnerable.
And Fernandez Blackshear, you have an HBCU background, attended North Carolina Central University. What about your upbringing brought you into healthcare?
Well, I was raised in a small town in North Carolina, Rayford, North Carolina. And in that small town, there was always a sense of helping others. And I always loved science, so it was just a correct fit for me. Whenever science meets helping others, that to me is nursing. And that's one of the reasons I chose to go into nursing.
Well, I certainly have a weakness for nurses. My mother was a nurse for over 50 years. And on the summers when I was home from school, she would bring me home masks and surgical caps, never thinking that this is what I would get interested in, especially since the only part of nursing she didn't like was surgical nursing. So both of you are on today because you're on the front line. And I thought it was important to get you to tell the story of what you're seeing and what you're experiencing. And so let's start with that. How are you feeling in general about the pandemic as a nurse in the emergency room, which is the point of first contact for a patient who may have symptoms, but not yet have a diagnosis? What is it like? And tell us, what are your emotions as you approach each of those patients who may be coughing, etc.?
Well, one of the things that we used to always say when I used to be in the military was safety first. And that's one of the things that our team has really put in place, safety first for not only the staff, but also our patients. And so we have taken that very seriously. And we have also have in place for the team, if there's any type of mental issues, that we can reach out to a mental health care provider that's provided by Howard University Hospital. So it has been a challenge, I will say, and but we're dealing with it, sir.
What are you seeing that you think may be a little unique or different to what we're hearing nationally?
So at Howard, we serve a large minority population. And the patients that we're seeing are all ages. We're seeing patients in their 20s, not just elderly patients. And a lot of the patients that we're seeing don't know they have underlying medical conditions. They may not know they're diabetic or that they have hypertension. And so, the patients that we are seeing, there's a lot more that we have to consider. We have to also consider their socioeconomic status. Do they have a phone number that we can call if this is somebody who we're considering sending home? Do they have a place to go to if they're discharged from the emergency department?
See, right now in the national dialogue is the fact that African American patients in particular who have comorbidities, and that means that they may have hypertension or diabetes, as you pointed out, may do worse. Based on what you have seen thus far, is that consistent with the patient population you're seeing at Howard? In other words, is a patient that comes in like that, are they more likely to be in respiratory distress, to be having such respiratory failure that they require intubation even down in the emergency room?
So 3 weeks ago, the patients that we were seeing in the emergency department were more worried about exposure. People wanted to know if they'd had contact, with someone who potentially had COVID-19. But the patients that we are seeing now are actually symptomatic and they're requiring intervention, sometimes intubation in the emergency department. And some of them do not require intubation, but they do require admission to the hospital. At Howard University Hospital, we're committed to keeping our healthcare workers safe while providing quality care to our patients. All our staff has been trained in the appropriate use of PPE. All the staff, clinical and non-clinical staff in the emergency department, wear a mask during all times that they're in the hospital. We are doing our best to keep our staff safe while delivering quality care to these patients.
And Fernandez, personal protective equipment has been a major concern across the country. Do you have enough personal protective equipment at present? And maybe you can describe for our viewers what exactly constitutes that personal protective equipment that you're currently using when you engage patients in the emergency room.
Yes, sir, Dr. Frederick. At this time, we do have enough PPE, personal protective equipment, which includes our N95 mask, which is the mask that each hospital personnel that comes in contact with the patient must be fitted for each year. So this is even prior to the COVID-19 pandemic that we're having right now. So we do have enough N95 masks, and we also have surgical masks, which are the typical mask, which is represented by, which is actually given by the CDC, which are considered like non-medical masks, which preferred for just a layperson to wear in the public now. And we do have those as well on staff. We have not seen a shortage at this time of any PPE, which also includes, along with the N95, the surgical mask, which also includes the face shield mask and our impervious gowns.
Now, obviously, it's early. We're expecting a surge in DC in the coming weeks, depending on which model you look at. When exactly that will get here, we're not sure. Are you concerned that as we see more patients, that some of that personal protective equipment may start declining? And what assurances have you received that make you feel comfortable that we will be able to meet that particular need?
Well, at this time, the chief nursing officer and the director of the nursing emergency nursing has given us the assurance that we do have enough PPE on hand at this time. And so to answer your question, yes, we have if we do see a surge, we should be able to cover that at this time.
And Dr. Bell, one of the other concerns with healthcare workers on the front line is when you go home, the concern is, are you taking that back home? Are you, as you engage with anyone that you may be living with, or the need for social distancing, or even on your transport back home, what are your biggest concerns and fears around that in terms of protecting your own self from exposure?
I think that is a concern for all healthcare workers in this current environment. We have physicians and nurses who have very young children, elderly parents, people who may be, immunocompromised, and so the concern is always that you want to treat patients, but you also want to keep yourself safe and your family safe. So some of the things that we have encouraged our staff to do is do not leave the hospital in the clothing that you have been working with all shift. We have partnered with a hospital to ensure that our clinicians are able to get scrubs and leave those scrubs at the hospital so they're not taking it home. We also encourage people, just to kind of do a head-to-toe check when you're leaving the hospital. You don't want to wear those shoes in. You want to make sure you're washing your hands appropriately, and commonly touched surfaces, we're very vigilant about keeping those surfaces wiped down, when you go to your car, so we're encouraging all our clinicians to take the necessary steps to make sure that they keep themselves safe and their families safe.
Now, there's the issue of testing, especially as it relates to exposure. And obviously, as you interact with every patient, even as you wait for that test to come back, that patient may have been a COVID-19 patient, and therefore you may have been exposed. In that circumstance, given the CDC guidelines of waiting until you have symptoms, self-quarantining, what are your thoughts? And I'd like both of you to answer, probably Dr. Bell first, and then you, Mr. Blackshear. What are your thoughts about testing, and what would make you most comfortable? And what are you currently subjected to under the regulations at the hospital?
So we definitely do not have enough testing. Because of the limited numbers of tests that we have, we truly are only testing symptomatic patients and symptomatic healthcare workers. One of the things that we have put in place in the emergency department is that we do temperature checks on all staff twice a shift. So at the beginning of your shift, you have your temperature taken. At the end of your shift, you have your temperature taken. The current guidelines are that, if you have been exposed to a patient with COVID-19, you can continue to work while wearing a mask. And the environment that we're in now, we actually do need all our workers, but we do not want anybody to be working while sick. Ideally, yes, we should be able to test our healthcare workers, even if they're asymptomatic, on a regular basis, so that we don't have any healthcare personnel acting as carriers, and so people can feel safe going home knowing that, they are not a carrier. And also so we can just have surveillance in the community. What is the incidence of this disease? But as is, we do not have that option.
And yes, Dr. Frederick, just to reiterate what Dr. Bell was saying, each healthcare provider was provided with a log. So all the team has a log. So even if you're off on your off day, it's recommended that you take your temperature twice a day, almost like you were working your regular shift. So each team member has been provided with a log to keep accountability of their daily temperatures.
That's excellent. And Mr. Blackshear, what about testing? Let's say you were exposed to a couple of patients, you go home, you say your temperature has gone up. How easy has it been for you and your colleagues to access testing at Howard University Hospital?
It's been fairly easy, especially if you are symptomatic. And it's recommended that any team member that develops symptoms to immediately come to the, if you can't make it to Howard University Emergency Department, go to the local, your primary care physician, or anywhere where there is testing.
Just to ask a follow-up question on that issue, usually the incubation period we know is from 0 to 14 days. So let's say you've been exposed, no temperature. Are you and your colleagues seeking testing to get a little more comfortable with that and to get some peace of mind, even if you don't have symptoms, somewhere in those 14 days?
Well, I don't know of any the exact number of providers or of team members that actually have been going outside regularly getting tested. So I can't give you exact numbers on that, Dr. Frederick.
Okay. And Dr. Bell, do you think that that's something that should be instituted, that maybe some random testing, regardless of symptoms, fever, etc., and if so, if somebody does come back positive, maybe taking that person out to the front line early? I know that's not the CDC guidelines, but I'm trying to get more of a sense of psychologically, how do you think that would make the frontline staff feel?
So I think there is a certain reassurance whether you're positive or negative, or even if you're tested and you realize that, you have antibodies, which means at some point you were exposed, but you're not sick. So, the clinicians that I've spoken to who have actually already tested positive and have recovered, they're reassured in terms of the fact that, okay, I have gotten over this and I can continue to work without, the fear of contracting it again. So I definitely think psychologically it makes a difference to kind of know what your status is.
Right. And especially since some people are asymptomatic, I guess that's a very good question to ask. And I don't mean to be just provocative, but as we think through this and we're learning as we go along, I can see that these things being an issue. And Mr. Blackshear, with that in mind, many of the frontline workers have described this as going to war every day. You are a former combat medic. Based on your own experience, how does this feel as you describe what you're going through, and especially given that background that you've had?
Well, in terms of stress, it is somewhat the same but different because you can't necessarily see the enemy. And so with that being said, that is what makes the difference. And sometimes that's even more stressful because you don't know, like we were saying, we have asymptomatic, staff could be asymptomatic, patients could be asymptomatic, and we just don't know. So and then plus it's something that we have to be mindful of when we're dealing with our family members, our relatives, our friends at any point in time. So the stress level is similar, not quite the same, but similar indeed.
And, Dr. Bell, just in terms of your de-stressing, to piggyback on Mr. Blackshear's point, what are you doing on your off periods to de-stress? How much news are you consuming, given that you're on the front line doing it for how many ever hours during the day, as you said, for 5 times a week, and then are you still going home and consuming the news?
So, especially in this environment, I think it is important to kind of limit the amount of input that you get, especially with the news. That can just increase anxiety. Personally, I limit news to 30 minutes a day. And, especially when you're in the ER, sometimes 5 days a week or more during a crisis situation like this, one of the things I try to do when I get home is, get some exercise, check in, with my family and friends. My mom is 70 years old. She still lives in New York City. But just to limit the number of news cycles that you're listening to, because that just tends to increase anxiety. The ER is already a stressful environment at baseline. And I think, especially during this pandemic, one of the reasons that it is more stressful for the frontline workers, because in the emergency department, we're used to being able to provide people, with comfort, either through the reassurance of, the procedures that you're going to do, or just being able to touch your patient or, a smile. But we go into patients' rooms wearing, a mask and a face shield and, eye covering, and there's so little of yourself that is reflected when you're attired like this. And because of the nature of the disease, obviously we're limiting physical contact. So I think that increases the stress level if you are a healthcare provider, because you feel like, there's only so much comfort you can provide. Because of the illness, patients don't have family members with them. And so, yes, it does increase the stress level.
And Mr. Blackshear, what are you doing to manage your stress and anxiety in this difficult time?
Similar to Dr. Bell, I also check on my mother, and she's in great health. Every time I talk to her, I get a little more inspiration. And so that's one thing that I do. The second thing I do is try to get out and walk periodically, just to get some fresh air. And I really don't consume too much of the news. I mean, most of the information that we're able to get from the CDC and from Howard University the staff is usually provided the up-to-date information. So I try not to consume too much because there's a lot of speculation and a lot of conspiracy theories and so forth. So try to just limit what I view on television.
Well, you know, I certainly appreciate and admire what both of you are doing. We're certainly humbled here at Howard University to be in a position to take care of patients, especially during a time like this. And so I certainly appreciate not just the risk that you're taking, but the dedication with which you're discharging those duties. So with that in mind, what types of advice would you give? There's that young person out there who is thinking of becoming that emergency physician, or that young person who wants to become a nurse and is looking at what is taking place here and is actually inspired. Some anxiety about it, but actually inspired by you. So starting with you, Mr. Blackshear, what would your advice be to that young person who wants to become a nurse like you and come and work at Howard University Hospital?
I would say go for it. Nursing is, the medical field in general, to include nursing, is a great profession. The ability to be able to move and work anywhere in the world, anywhere on the globe. And so, and then to be able to just help people, take care of people with compassion, I would say go for it. To any young person or any, it doesn't matter, any young, old, at this point, if you're interested in it, I would say go for it, Dr. Frederick.
I'm with Mr. Blackshear. I say go for it. If this is your dream, make it your passion. And it is a lot of hard work. You'll meet some hurdles, but every time somebody tells you no, let it inspire you a little more. You'll never regret becoming a doctor. You will have the assurance of waking up every day knowing what your purpose is, and you will have the chance to impact someone's life and to make a difference in the world, especially with the trends that we're seeing with healthcare and healthcare disparities.
Well, like I said, I am very, very grateful to know both of you and to have both of you on journey today. We're very humbled at Howard to be able to provide healthcare in the District of Columbia to its residents. And clearly what you're doing during this pandemic is really stepping up there. So I certainly thank you for giving our listeners and viewers an opportunity to hear from frontline workers what's really taking place. And so my guests today have been Dr. Maureen Bell. She's the Director of Emergency Medicine at Howard University Hospital, and Mr. Fernandez Blackshear, who is a nurse at Howard University Hospital as well. Both in the ED, both frontline workers, really giving all they can, and as you can tell, with a lot of compassion and care, and that's very humbling. I'm Dr. Wayne Frederick. Please join us next time for The Journey.